It is now in order to consider Amendment number 19, printed in Part B of the House Report 118-272. For what purpose does the gentleman from Florida seek recognition?
Mr. Chair, I have an amendment at the desk.
The clerk will designate the amendment.
Amendment number 19, printed in Part B of House Report number 118-272, offered by Mr. Mills of Florida.
Pursuant to House Resolution 864, the gentleman from Florida, Mr. Mills, and a member opposed, each will control 5 minutes. The chair recognizes the gentleman from Florida.
Thank you, Mr. Chair. This amendment cuts back spending for the Office of Public Health and Scientific Services by more than $158 million to return us back to our fiscal year 19 funding levels. This reins back the irresponsible balloon spending that we've seen during the COVID-19 pandemic. The House of Representatives has to hold itself accountable to fiscal responsibility. We cannot continue to spend money that we do not have, entrenching our country into more debt that future generations will be unable to pay back. Our public health offices, particularly during the COVID-19, have proven they do not effectively follow scientific method. In fact, I would argue that this body only follows political science, not medical science. While some of these offices certainly played roles in helping to research the effects of COVID, others, like the Office of Public Health Scientific Services, were ineffective and do not serve their purpose. We do not need another redundant public health office to advance politicized work of the federal government's public health operations. And furthermore, as a business owner, I know the value of industry driving policy and not policy driving industry. These cuts encourage increased collaboration with the private sector to leverage external resources and expertise to support the public health initiatives. With that, I reserve.
Gentleman reserves. Any member claim time in opposition?
Chair, I claim time in opposition.
For what purpose does the gentlewoman from Connecticut?
I rise to claim time in opposition to this amendment. This amendment would reduce the Center for Disease Control and Prevention.
Gentlewoman is recognized for 5 minutes.
Okay, thank you. This would reduce the CDC's Public Health Scientific Services account by $158 million. Bringing this account to the 2019 level, what would it eliminate? Think about it. Significant advancements in public health, negatively impacting the National Center for Health Statistics, for laboratory science, and for public health data modernization efforts. I have personal propriety on data modernization. I championed and I established the establishment of a public health data modernization initiative in fiscal year 2020. Just prior to the pandemic, I might add. A massive undertaking is moving public health away from the fax machine and into the 21st century. Think about what happened during the pandemic with all of the laboratories around the country. I'll speak about Connecticut. Nearly shut down. Couldn't do its work because it doesn't have the equipment, the modernization, the ability to collect data that makes it incredibly important for us to deal with a pandemic or any other disease. This provides, this modernization initiative, I might add, provides funding directly to 64 jurisdictions, states, territories, large cities, tribes. Eliminating this funding impacts the entire country. We look to, and I suspect that my colleague on the other side of the aisle has the same view, as that the local jurisdictions, the public health, needs to have the capacity to do its job. This funding is critical to improving jurisdictions' public health decision-making capabilities. And that is for, some have very high-rated and forward-thinking and decision-making capabilities, and they have what they need. But we have a lot of communities with minimal capacity, such as those, this is really pretty extraordinary. We have people entering records by hand. They're writing their records out by hand or using software not designed for tracking outbreak data to be able to publish provisional national death data on a weekly basis. Some places have no capacity to do this, and they're not reporting the data, so that we have no idea what is happening. You know, look, we all want to know the scope of a foodborne or an infectious disease outbreak in our community. I suspect my colleague wants that information for himself, his family, and for his constituents. We all do. But that does not happen without the data first identifying the cases. Our public health data systems, laboratory resources, and the National Center for Health Statistics are already so far behind where they need them to be. And this amendment would only make matters worse. We should have learned a very, very big lesson from the pandemic, where our public health infrastructure, in many instances, crashed because of the lack of technology, the lack of data collection, of lack of modernizing their ability to collect that data. So I urge my colleagues to oppose this amendment, and I reserve the balance of my time.
The gentlewoman reserves. The gentleman from Florida is recognized.
Well, I appreciate the gentlelady actually stepping up. She has two key questions that I really liked. First off, what would it eliminate was one of the questions. Well, what it would eliminate is the wasteful and fraudulent spending that has gone to the NIH, as well as for those who've actually continued to pursue things like gain of function under Fauci, as we saw how that worked out. The other thing is that she also questioned, what should we have learned? Well, what we have learned is that we are actually spinning ourselves into an economic abyss. The fact that we are actually leading the nation when it comes to continually frivolous spending. And I love how only in Washington can we call something emergency spending levels, but then maintain it throughout the period in which we're going to move forward. We have to acknowledge the fact that in 2019, pre-COVID spending levels, if you did a 3.5% adjusted rate, that would get us to an actual spending cap of 1.477 today, not the 1586, not the 1786, and certainly not the $2 trillion that the Democrats want to continue to spend. The bottom line, Mr. Chair, is this. We are not saying that we will not have the necessary spending for our public health sectors and others to continue to do their job. What we are saying is that we should return our spending levels to pre-COVID, pre-emergency levels that would be in sync with what we have always done at the 3.5 adjusted rate. With that, I'll reserve.
Gentleman reserves. Gentlewoman from Connecticut is recognized.
I oppose the amendment. I think it's not just for the emergency. We need to have a very, very strong public health infrastructure. And with that, I yield back the balance of my time.
Gentlewoman yields back. Gentleman from Florida is recognized.
I'll go ahead and close with this, Mr. Chair, which is that it is very clear that the only thing that D.C. continues to do successfully is spend American taxpayer funding. We did not do what was necessary to mitigate these risks. There was always this 2 weeks to slow the curve. I wish there was 2 weeks to slow our spending. We need to get back to where we were before so that we can get control. Start looking at economic growth, start looking at what's best and having industry drive the actual policy, not policy drive the industry. And we need to reduce and limit the government's reach into the public sector to ensure that they have what they need driven by them for them. With that, I yield.
Gentleman yields back. The question is on the amendment offered by the gentleman from Florida. Those in favor say aye. Aye. Those opposed say no. In the opinion of the chair, the ayes have it. The amendment is agreed to.